and welcome to your ALH 3 Chapter 5 lecture on prescriptions and labels. The key objectives for this chapter are to define key terms, discuss precautions to ensure patient safety, identify the parts of a legal prescription, differentiate between 3 different types of medication orders, list which healthcare providers are able to write prescriptions, define abbreviations used in prescriptions, interpret labels safely, and discuss the impact of e-prescribing on healthcare consumers. So, medication orders take a variety of forms, including handwritten or typed, verbal or electronic, and these electronic are done directly to the pharmacy. And we're going to talk about those. So written orders are desired whenever possible to avoid mistakes. Written or typed clearly and accurately, and they may be typed or written by others, but signed by the prescriber in most instances. It's important to note that Schedule II drugs must be written and signed by the prescriber. Verbal orders is where the prescriber directs another healthcare professional to write a prescription. And this can happen in the state of California. So as a medical assistant, this is something you might be required to do. The order may be in person, emergency, or via phone. And the transcriber should write words and numbers carefully and read what they have written back to the prescriber. It's very important. And in this, for the medical assistant, the doctor needs to be there with you, and the doctor needs to check and verify what you have written. So an emergency situation via phone, the doctor would not be on site with you, therefore you would not be taking that emergency via phone. You would only do it if the doctor was with you in the office. Again, that's a scope of practice in the state of California. So in emergencies, verbal orders should be signed before, and again, if it were taken by phone and the doctor was not on site, you could not do this unless you had multiple doctors in the office that you work under, all of their license, and then they would be able to check that written prescription and then sign it. In all instances, verbal orders must be signed as soon as possible so that there isn't a mistake made, because again, time and issue can come up where maybe a small detail was forgotten. So again, let me reiterate that the order for a medical assistant, if you were going to be transcribing, you would be in the building with the physician, transcribing what the physician is saying, and the physician would check and sign that prescription. In other states, that is different. So let's do a comprehension checkpoint. In an emergency, it is not necessary for a verbal order to be signed. Hopefully you know that that's false, because we just said that on the last slide. It still needs to be signed, and a prescriber should sign a verbal order before the medication is administered, and this protects the healthcare worker legally. Again, we have to work within our scope of practice. It is not within our scope as a medical assistant to diagnose or prescribe. Obviously, this is the doctor. We're there to assist the doctor, and we must work under our scope of practice. E-prescription orders, these are prescriptions that are created electronically by the prescriber, and they're sent directly to the pharmacy. May be able to verify insurance coverage online, and you also may be able to identify any medication interactions due to the fact that if the patient is seeing one doctor or 2 or 3 within one system, those are entered, and then you can see the medication reactions. Now, as a medical assistant, this e-prescription is very important because we use electronic health records, and your part in it would be when you are rooming the patient that you are verifying that the correct pharmacy that they currently use is updated in the computer so that that prescription does get sent to the correct pharmacy and not an older pharmacy. Maybe they've moved. So again, checking correct address and correct pharmacy that they're currently using would be a big piece of your job as a medical assistant in e-prescribing. This avoids illegible writing because it's done electronically. It also avoids loss of written prescription because it's all in the computer, and missing information on the prescription because it's filled out through the electronic, the EHR system typically, and the e-prescribing goes straight to the pharmacy. So, standing medication orders. This is a list of orders used in specific circumstances that routinely occur in your office. So, an example of this would be preparation for procedures. And even though they're pre-printed, they still require review and signature by the prescriber. And they are reviewed and signed, and then that's a standing order. I can give you an example of this when we were in the office and I worked in peds, and it's not specifically to a medication, but it's one of the standing orders that we did regularly. We had a standing order that if we noted certain steps when looking at a patient that's there with a sore throat and reporting of maybe white bumps in the back of the throat, they have a fever. So there was a list of things that if the patient was presenting with, then we had a standing order signed by the doctor to perform a strep culture so that it would be ready for the physician when they came in. These should be routinely reviewed and updated to make sure that everything is current for the doctor and for the office. Automatic stop orders are orders that are for a limited period of time. They're most commonly used for Schedule 2 and 3 medications after an injury or a surgical procedure, and it usually needs to be reordered routinely every 3 days. That's an example. It depends on how that is set up. And on stop medication orders, it's important that we remember that they are given for a limited time and that stop orders cannot be refilled unless the prescriber reviews it. Prescriptions must contain a set of amount of information allowing the pharmacist to safely dispense medications to the patient. There are two types of information required. The administrative information includes the doctor and patient's contact information, as well as the physician's credentials and the patient's date of birth. And the second type of information gives specifics, such as which drug is to be dispensed and in what quantity, strength, and form. Oops. And here we are on the prescriptions. I apologize about that. So, prescriptions with written record of the prescriber order, prescribers, physician, nurse practitioners, physician's assistants, and this varies again from state to state. So the actual prescription is the written record, the actual order, and then the people who can prescribe, physicians, nurse practitioners, and physician assistants, are all able to prescribe in the state of California. And let me remind you that as a medical assistant, we are never able to diagnose or treat or prescribe. And I know that you know that, but it's something you'll hear me say throughout because, again, the scope of practice is key. We must always be operating within our scope of practice. So the following are allowed to write prescriptions. What do you think is correct here? E. So a DO, a doctor of osteopathy, is a doctor, and they are able to prescribe. They're more of a systems-based doctor, but they are still a physician. So the correct answer is a DO, an MD, a nurse practitioner, a physician's assistant. All in the state of California are allowed to prescribe. So I messed up on that previous slide, so I'm just going to reiterate what I said here as we go. Prescriptions must contain a set of amount of information, allowing the pharmacist to safely dispense medications to the patient. And there are two types of information required. The administrative information, this includes the doctor's and the patient's contact information, as well as the physician's credentials and the patient's date of birth. And the second type of information gives the specifics, such as which drug is to be dispensed, in what quantity, and the strength and form. So on the parts of the prescription contain name, contact information, and drug enforcement DEA number, which we talked about in a previous lecture, name, address, and date of birth of the patient, date of the order, the RX or the superscription, which means take thou, the inscription, which is the name of the drug, dosage, and quantity to be dispensed, the signature, and this is the directions for taking the drug, the subscription, where you can see here on refills, and again, hopefully this little yellow thing works there. So where the refill numbers are marked, and it should never be left blank because something like 0 or none should always be written there if there aren't any refills. And whether a generic can be used, this is important for the pharmacist because they need to know if it can be replaced with a generic, if this saves the if it can save the patient money, then sometimes they will do that and make the replacement. This way they don't have to call the doctor. And then obviously the signature of the prescriber. Signature is from the Latin word signatur, meaning to write on the label, and it provides instructions to patients in lay terms. So that's why a signature on a prescription part is the directions for taking the drug, and then we also need the actual signature of the prescriber. Here's another comprehension checkpoint. The parts of the prescription that tells how many refills are allowed is if you selected C, subscription, you are correct. This is the refill information. So let's talk about drug labels. Drug labels are required to provide information to allow patients to safely receive medications. The manufacturers must provide information on the label and on the package insert to allow the healthcare provider to safely administer or dispense medication. The drug labels are regulated by the Food and Drug Administration, the FDA, which determines what needs to be on the label. A dispensing pharmacist label must be included with the pharmacy name, address and phone number, the dispensing date, the RX number, and this number identifies its unique prescription in the computer system, and it also must include the patient's full name and address. Go ahead when you get a chance, if you have any prescription bottles in your house, check it and check the label, and you will see that they should be all included there. The dispensing date may differ from the date on the prescription depending on when that prescription is written and when that prescription is filled. So that's one important note. So on the dispensing pharmacist label, it needs to include the manufacturer's label and names, the National Drug Code, the NDC, which is a number and lot number, and this is so that we can track back if there are any issues with this drug, who received that drug with the lot number in order to do a recall or different things. The name of the medication, its generic and its trade name, the strength, dosage form, and quantity, and the manufacturer if it's generic. Also the route of administration, again, so how is this being taken? Is it sublingual? Is it oral? Is it rectal? And the refill information, how many refills are available or should be refilled. It also has the name of the prescribing physician and credentials, so the it would say like MD or FNP or DO. So not only just the name of the physician, but what are their credentials in order to write the prescription. Expiration date of medication, any warning labels. And you'll see when you get this, especially from a pharmacy like CVS, this all comes in a leaflet or a handout with all of this information, and they do pharmacy consults if this is a drug that you have never taken before, or if you have any questions regarding it. So the pharmacist translates the Latin abbreviation